Wellness Rhythm Show. Find your rhythm. Live your wellness.
Y'all, let me tell you something that happened to me last Tuesday. I was sitting on the couch, doing absolutely nothing, eating a granola bar, and I randomly checked my smartwatch. And it said my resting heart rate was 72 beats per minute. And I thought, is that good? Is that bad? Should I be worried? Should I eat more granola bars?
Right, and here's the thing. That number you glanced at for 2 seconds is actually one of the most powerful windows into your cardiovascular health. Not your cholesterol panel, not your blood pressure reading at the doctor's office. That quiet little number when you're just sitting there.
Which blew my mind, honestly, because it's so simple. No needles, no labs, no copays.
Exactly, so today we're unpacking resting heart rate. What it actually means, what the research says, and why it matters whether you're 28 or 68. This one is genuinely useful for everyone.
Okay, so let's start at the beginning. Resting heart rate. What is it actually?
So your resting heart rate, often abbreviated RHR, is simply how many times your heart beats per minute when you're at complete rest. Not mid-workout, not stressed about an email, just quietly existing.
And the best time to measure it is first thing in the morning, right? Before you've even had coffee?
Precisely. Before caffeine, before stress, before you've checked your phone, just lying there, awake but calm. That gives you the most accurate baseline.
Mine shot up about 15 beats the moment I opened my inbox. So, good to know.
Right. So the American Heart Association defines a normal resting heart rate for adults as anywhere between 60 and 100 beats per minute. But here's where it gets interesting. Just because 99 is technically normal doesn't mean it's optimal.
That's the nuance I want to dig into. Because I used to think, oh, I'm in the normal range, I'm fine. But you're saying fine and thriving are different things.
Completely different things. Research published in the journal Heart, a large study following over 29,000 people, found that higher resting heart rates within that so-called normal range were actually associated with significantly increased risk of cardiovascular disease and mortality.
So, a resting heart rate of 95 and a resting heart rate of 62 are both normal, but they're not the same story.
Not even close. The sweet spot most cardiologists point to is somewhere between 50 and 70 beats per minute. And well-conditioned athletes can sit comfortably in the 40s.
Here's the thing, though. When I first started paying attention to mine, it was consistently around 78, and I was not thrilled about that.
That's actually very common, especially for people under chronic stress. And this brings us to what your resting heart rate is actually telling you.
Break it down for us.
Your heart is a muscle. The fitter and more efficient it is, the fewer beats it needs per minute to move blood around your body. So a lower resting heart rate in a healthy person typically indicates a stronger, more efficient cardiovascular system.
It's like a really good fuel-efficient car versus one that's revving constantly just to idle.
That's actually a perfect analogy. And on the flip side, a consistently elevated resting heart rate can be a signal that your heart is working harder than it should, which over time puts strain on the entire system.
So what drives it up? Because I know for me it's stress. But what else should people be watching?
Great question. Poor sleep is a massive one. Research from the University of California, San Francisco found that even modest sleep deprivation elevates resting heart rate. Then you have dehydration, excess caffeine, alcohol, sedentary behavior, and of course, chronic psychological stress.
Oh, dehydration. I did not know that. When your body is low on fluid, your heart beats faster to compensate?
Exactly. Your blood volume actually decreases slightly, so the heart compensates by pumping more frequently. It's all connected.
And if you're in the sandwich generation, juggling kids and aging parents and a full-time job, all of those stressors are potentially running in the background, keeping that number elevated.
Right. And this is where I want to give credit to Dr. Zeljko Pedicic and colleagues at Victoria University, whose research on sedentary behavior and cardiovascular markers showed that even breaking up long sitting periods with short movement snacks, their term, had measurable effects on resting heart rate over time.
Movement snacks, I love that. Okay, but let's talk about how to actually improve your resting heart rate, because I know that's what people are here for.
The most evidence-backed intervention, and this is not a surprise, is consistent aerobic exercise. The European Society of Cardiology recommends at least 150 minutes of moderate aerobic activity per week. And the research consistently shows that over weeks to months, this lowers resting heart rate.
And I want to be real with y'all. I did not go from 78 to anything better by doing one intense workout. It took months of consistency. Walks, some cycling, nothing heroic.
That's actually the correct approach. A 2018 meta-analysis in the British Journal of Sports Medicine confirmed that moderate, sustained aerobic activity is more effective for lowering RHR than sporadic, high-intensity sessions. Yins for most people.
And what about stress management? Because I also noticed my number came down when I started being more intentional about that.
Brilliant point, Emma. And there's solid research behind it. A review in the Journal of the American College of Cardiology highlighted that mindfulness-based stress reduction, developed by Dr. John Kabat-Zinn at the University of Massachusetts, showed statistically significant reductions in resting heart rate among participants.
So it's not just relax and you'll be fine. There's an actual physiological mechanism.
Correct. When you activate the parasympathetic nervous system, your body's rest and digest mode, it sends a signal called vagal tone that literally slows the heart. Breathing practices, meditation, even gentle yoga do this.
Okay, y'all, this is such good stuff. And if you're finding this useful, please do us a favor and hit that like button and subscribe to the Wellness Rhythm Show. It really does help us reach more people who need exactly this kind of practical information.
Much appreciated. Now, I do want to address some nuance here because I think it's important.
Please. Because I know people who are going to look at their number and spiral.
Right. So a single elevated reading means almost nothing. Context matters enormously. If you're fighting a cold, your resting heart rate will be elevated. Hormonal fluctuations, certain medications, even your hydration status that morning can shift the number.
So we're looking for trends, not a single snapshot.
Precisely. Track it over weeks and months. Most wearables, like the Apple Watch, Fitbit, Garmin, or Whoop, do a reasonably good job of averaging this over time. Dr. Evan Wood, a cardiologist at Stanford Medicine, has noted publicly that the trend line on wearables is genuinely useful clinical context.
I want to bring up one more thing, and this is where I'll be honest, I had a moment of friction with the research.
Go on.
So I read that sleeping more was one of the most impactful things you could do for resting heart rate. And my instinct was, yes, sleep is free. This is great advice. But then I felt a little, frustrated. Because for so many people in our audience, especially parents of young kids or caregivers, sleep is not a controllable variable.
And that's a completely fair pushback. The research is unambiguous that sleep helps. But the research also can't tuck your toddler back in at 3 a.m. So the honest answer is, prioritize sleep where you can. And in the meantime, focus on the levers you do control. Movement, hydration, stress tools.
That's the most practical thing you've said all day, and you've said a lot of practical things.
I have my moments.
Here's the thing, though. Your resting heart rate is not a judgment. It's information. And information is what you use to make small, manageable changes.
Agreed. And for listeners over 50, particularly pre-retirees and those managing other conditions, it's genuinely worth bringing these trends to your GP or cardiologist. Not to alarm anyone, but because it gives your doctor useful longitudinal data they otherwise wouldn't have.
Such a good point. Your wearable data is worth discussing. Don't just let it sit in an app. Okay, so if you're walking away with one thing today, here's mine. Check your resting heart rate in the morning before you get out of bed for the next 2 weeks. Just note it, don't judge it, get curious about it. Then add a 20-minute walk 3 times a week and see what happens over a month.
And my takeaway is a little more precise. The target zone most supported by research is between 50 and 70 beats per minute for general cardiovascular health. If you're consistently above 80, it's worth a conversation with your doctor. Not a panic, a conversation.
That's the optimistically realistic vibe we're always going for on this show. Y'all, thank you so much for spending this time with us. This stuff matters, and you matter.
Right. Your heart has been working hard for you every single day. Probably worth returning the favor.
Until next time, keep the rhythm going. This show is part of the VoxCrea.ai system. If you want a show like this for your organization without building it yourself,
go to voxcreel.ai and request a sample episode.